Okay, so now I'm going to show you some of these studies that upset basically all of established medicine in the world in the middle of the pandemic, in the middle of COVID. But one study specifically took everybody's attention in medicine and in science that were trying to quell the pandemic, as you remember. And it took everybody's attention and pointed it to an entirely different direction. And that direction is this. Look at this. This study turned the COVID world on its head by daring to speculate that a nutrient deficiency, a single nutrient deficiency, was key to all COVID outcomes. In any other time, that would have been considered ridiculous. It's just like another little paper goes back the last 100 years or so saying, hey, here's a thing that's going to change your life. You know, it used to be called the snake oil salesman or the patent medicine traveling salesman throughout the West. That was the image that you got. But here we are, kind of in a global state of emergency, not a kind of, we are. And this study came out. It's a Russian study, very well done, incredibly well documented. So it's saying, no, wait a minute, I think it's one nutrient deficiency. If we focus on this, we can save millions of lives. Well, spoiler alert, most of the West, developed countries, didn't focus on this. And he's right, they could have saved millions of lives. So here's the name of the study: endogenous deficiency of glutathione, meaning your ability to make glutathione, as most likely cause of serious manifestations and death in COVID-19 patients. Russian. It began a ripple of thinking that went around the world and caused doctors to think differently about how to treat COVID. And after this study, you get a pinballing around the world of different studies coming out in this particular focus saying, this is what we're seeing, this is what we're seeing. It gets more and more documented. So it's not like the patent salesman on the back of the horse-drawn carriage trying to sell you something that's going to change your life. They're saying, no, there's a lot of research behind this. Let's get into it. So the questions start pouring in at this point, leading to studies about glutathione, homocysteine, and methylation regarding COVID, right? COVID's all around us. We're in year one, the end of December in 2019 is when SARS-CoV-2 was reported in Wuhan. In March 2020, that was the demarcation of when the outbreak was declared globally. It was a global pandemic from March 2020. So just get that frame, because we're going to go through a bit of a timeline so you get the relevance of all these studies and their discovery, how they collaborated, not knowing each other. Look at what the studies are, when they came out, and where they were from. Here's the timeline: discovery, speculations, interventions from around the world. 2020, more in 2021, more in 2022, that changed how COVID was treated. And right now, even though we're looking back at COVID, you can think of it as the flu season. We're talking about viral respiratory infections. Coronavirus, which is what COVID is one of many, and we've had them before. So it's a collection. This is a way to look at how to treat viral respiratory infections, aka the flu season, in perpetuity in the future. From year, I put all these together. The COVID Studies Yearbook 2020, Glutathione and COVID Studies, the role of glutathione in protecting against severe inflammatory response triggered by COVID-19. That's July 2020. That's an Italian study, so that's just, 3-4 months after the pandemic was declared. So conditions associated with low glutathione. So GSH is reduced glutathione. We're talking about reduced glutathione, not just glutathione, but reduced glutathione, especially see the last video if you haven't gone over that before. Lung infections, HIV, diabetes, cancer, and age-related diseases, severe COVID-19 diseases. So lung infections, HIV, diabetes. They would say that, well, wait a minute, wasn't diabetes a comorbidity and people who had diabetes died or had worse outcomes? They did. Maybe it's because they were low on glutathione. You guessed it. So drugs that decrease reduced glutathione levels. This is famous, acetaminophen, otherwise known as a whatever you want to call it, paracetamol, Tylenol, in other words. In fact, the World Health Organization declared in 1963 that glutathione was the antidote for Tylenol poisoning, for acetaminophen poisoning. Other drugs are adriamycin, which is an antibacterial, antimalarial drugs, chloroquine, which is an antimalarial drug, opiates, ethanol. So deaths, this is just from a headline, deaths caused by alcohol spiked by 26% during the pandemic. Antidepressants, most commonly prescribed medication in the US. So look at that list. So the year is 2020. We're starting to ask for help globally, internationally. People are saying, no, this is what I'm saying. This is what I'm saying. That was the year of the lockdown. Year one, glutathione supplementation as an adjunctive therapy in COVID-19, 2020. It's an American study. Notice in the US, you have to say everything's adjunctive because really the main treatment is, we'll call them pharmaceuticals, and everything else is adjunctive. In the other parts of the world, certainly in Russia, they didn't look at it that way. They said, no, this is the thing, give people this thing, they will improve. And that was proved. Based on the evidence showing glutathione, reduced glutathione, inhibits viral replication and decreases levels of IL-6, which is an inflammatory marker, in HIV and tuberculosis patients. So that's history. They're looking back and said, hey, wait, it helped people with HIV, it helped people with tuberculosis, maybe, and then we know it helps with viral respiratory infections like COVID, benefits pulmonary diseases processes in general. So the conclusion is we believe that liposomal, which is a form of glutathione, liposomal reduced glutathione could be beneficial in COVID-19 patients. Mind-blowing. Still in 2020, the first year, remember it was March 2020, it was declared a pandemic. Could glutathione depletion be the Trojan horse of COVID-19 mortality? What a great title for a paper, right? So what they're doing, they're speculating, saying they're not quite as confident as the Russian study, right? They're saying, maybe glutathione is involved in this and maybe we should check it out. And here's their questions. They're trying to be polite to the rest of the world, I guess. So the abstract was, since the emergence of COVID and the death toll has been increasing daily, many risk factors are associated with high mortality rate in COVID-19. Establishment of a common pathway among these risk factors, common sense, could improve our understanding of COVID-19 severity and mortality. There you go. Common sense. Good place to start. So the conclusion is, in this preclinical study shows that reduced glutathione may be a central role in COVID-19 mortality, deaths, and the pathophysiology, basically the process of the disease of COVID and associated conditions. Therefore, increasing reduced glutathione levels in tissues may decrease the severity and mortality of COVID-19. Do you think? So that's just a common sense question. As we look back on some of these studies, you go, I get it, I see it. You know, it's obvious as a stoplight in the middle of the highway, or more or less, right? Actionable information here is this is something everyone can do. Every country can do. This is what's happening here. It's coming in. They're saying, how do we do this? What are you doing? Let's compare. Back and forth. So the COVID Studies Yearbook 2020, glutathione and COVID studies, the efficacy of glutathione, this is also in the States, of glutathione therapy in relieving dyspnea, difficulty breathing, associated with COVID-19 pneumonia, a report of 2 cases. This is 1 month after the pandemic declared. And this is from Hudson River Healing Arts Center, Hyde Park, New York. We're going to tell you why I pointed this out in a second. So here's their conclusion was, after doing this for 2 people, just on 2 people, oral and IV glutathione precursors, NAC, N-acetylcysteine, and alpha lipoic acid. They threw the whole barn at this patient. So alpha lipoic acid, as mentioned in previous videos, is kind of a related sulfur compound that helps glutathione increase. May represent a novel treatment approach for blocking this is specific inflammatory pathway called NF-kappa B, if you want to know, and addressing cytokine storm syndrome. Remember, everything was a cytokine storm. We're having a cytokine storm. How do we help people control their cytokine storm? That's true. There was a cytokine storm, but all the news was about the cytokine storm. And respiratory distress in patients with COVID-19 pneumonia. So these people, so that was the 3rd month, that was 2020. Now in 2022, with the University of California at Irvine, they're doing a clinical study on basically their results. So the role of glutathione deficiency in long COVID-19, May of 2022, so just last May. The purpose is to assess if liposomal glutathione, NAC, and alpha lipoic acid can help reverse some of the COVID long-haul symptoms. And there's their clinical trial registered. Why did I put this little map here? Why do you need to know where this place is? There's New York City, and this is basically for people not in the United States, this is halfway between New York City and Albany. It's a very, very affluent area, nothing wrong with that. But what I'm showing you, this is how healthcare is actually meted out in the United States. If you're educated and affluent, you can find the healthcare, long story short. And you go to basically concierge physicians and said, I don't want anything to do with insurance for the most part, and I'll be your guy. And so they get really, how many people do you know can have IV glutathione? Not many, not many. And in a hospital, far fewer. So this is a very special place where they really get to say, let's do the most effective thing for you personally, since you're my patient. They can go outside the system. Here's the big picture. So why glutathione deficiency is a problem. Okay, so let's start over here. SARS-CoV-2, COVID if you want to. Here's the NF-kappa B, it's inflammatory pathway. So you inhale it, you get SARS-CoV-2 and it starts growing, right? Your viral load starts growing. Maybe you can control it, maybe not. But the first step is you do get a big cytokine storm. For some people, that's the end of it. They have the cytokine storm, it takes care of the virus and they can move on with life. Others, they can't control the cytokine storm because they don't have enough glutathione and it gets bigger and bigger and the inflammation gets bigger and bigger. It gets to be a double, bacterial infections on top. They have to be put on ventilators, ECMO, and antibiotics at the same time. It gets to be a huge mess. But anyway, so the virus comes in and the first thing it comes into the ACE2 receptors on our cells, which is basically the back of our mouth, our nose, our throat, and our lungs, and throughout the rest of the body, but that's the main part. So it comes in, and that's how it gets into the cells, and then it starts duplicating. So SARS-CoV-2 comes in, starts to take over, but with glutathione is just the opposite. Glutathione protects the receptors, so SARS-2 can't get in or gets in minimally. Reduced glutathione blocks the growth, the expansion of the reactive oxidative species, so it reduces the cytokine storm, keeps it contained and effective. And this is basically all from the role of glutathione protecting against severe inflammatory response triggered by COVID-19 antioxidants. It was a big Italian study. Now they're getting into it. This is really about glutathione and studies. It's not just hypothetical. Do you know? You think? Nope. It's big deal. So with glutathione, enough to reduce glutathione, you don't have exacerbated inflammation. You don't have a decreased immune response, which is what the worst outcomes had. Okay, so this is from another study, severe COVID-19, what we have learned with the immunopathogenesis. 2020 Brazilian study. I took their chart, which was really good, and it was a little confusing. This is somewhat confusing, but I'll walk you through it because this is how everybody decided to look at the progress of COVID, of SARS-CoV-2, the virus. And it started this way. You had a stage 1, you had a stage 2, and you had an uncontrollable stage 3 that led to acute respiratory distress syndrome, meaning you're on a ventilator, you're on ECMO, and or you died. If you didn't die, you certainly went into long COVID. It took a long time to recuperate. And people still have long COVID, by the way. So phase 1 is mild disease, fever, fatigue, dry cough, loss of smell, loss of taste, headache, muscle ache, sore throat. You're over and done in about 5 days. So it's a 5-day resolution. So stage 1 is 5 days. For those who have enough glutathione, reduced glutathione, strong enough immune system, which is basically the core is reduced glutathione, they can control and contain the viral load and the inflammatory response is done and over with. They're moving on in their life. Those who don't have the ability to control the viral load from getting bigger and bigger and bigger in stage 1, so you see the severity of the illness goes up this way, and this is time that goes over this way, day 16, day 8. All right, so now it goes into the inflammatory response gets bigger and bigger. It's starting to get out of control. And by the way, these dotted lines, the dotted line of phase 1 is just this green, it's just this green little rise and fall. The dotted line of phase 2 is this dark brown one. You see that it goes up, and at end of day 5, it sort of plateaus for about 4 or 5 days. And you don't know if you're going to get it better or you get worse, but you're not getting worse, and then it starts to uncontrollably get worse. That's the worst outcome. Sorry, the phase 2 starts to get worse. You peak around day 8, and you get over it really around day 14, 10 to 14. So it's about a 10-day resolution, 5-day resolution stage 1, 10-day resolution stage 2, and infinitely long and or possibly death for stage 3. So what we're seeing is growing viral load, growing inflammatory response. Then it goes further. The viral load's getting even bigger and bigger and bigger, and most likely at this point you have a bacterial infection on top of it. So you're really getting a lot to handle, but you have an uncontrolled inflammatory response. And that's what stage 3 is about. So that's the COVID progression. So that came out of a Brazilian study, but that's how internationally it locked it down, saying this is it. This is the stages of COVID. We know what we're doing. We know what it looks like. Again, 2021, now we're into year 2, the COVID Studies Yearbook 2021, glutathione deficiency in COVID illness. Does supplementation help? Pretty basic. From OMA, glutathione supplementation appears safe and could possibly be helpful. Testing for glutathione is not done routinely, do you think? Therefore, clinicians should identify patients at risk of glutathione deficiency. So who would those patients be? Those who don't have the appropriate nutrition, certainly G6PD, like we've talked about in the previous video, and there's others in here, but you need to test for what the glutathione level is. So by not testing, you're not going to know. So it's not a one-size-fits-all. They're the ones that are saying it's not a one-size-fits-all. We need to subdivide these particular cases of people who are not doing well and help them. The potential mechanism of N-acetylcysteine in treating COVID-19 from China, 2021, NAC. NAC is over the counter in the United States. You can walk in, you can get it. NAC's action beyond its role as a precursor to glutathione, in addition to being the thing that's going to be changed into glutathione, it replenishes your cell supplies of glutathione on a regular basis, of course, protects your cells against free radicals, reactive oxygen species, kind of the same thing, different terminology. Additional potential benefits are helps regulate the expression of genes involved with the inflammatory process. So it's not just glutathione. It says, hey, let's like downregulate some of these inflammatory genes. Good idea. Support normal insulin sensitivity. That's a big deal. Hence the diabetes, right? Why was diabetes a comorbidity? It's because they didn't have enough glutathione. Yeah, they had the whole dietary thing, but it was the glutathione that they lacked because they were diabetic, because they didn't have the insulin sensitivity. Okay, support respiratory health, protect tissues and cells from reactive oxygen stress, and exercise. People who have COVID exercise a little bit, they get wiped out. Long COVID, they can't exercise. They try a little bit and they get wiped out. So too much reactive oxygen species, too much stress. Supports cellular growth and development. That's a big deal. Here's a study that is really cool. UK and Sweden. This is now a year after the pandemic was declared in March of 2020. This is now, April of 2021. They're saying, is COVID-19 a methyl group assault? They're not saying, they're going beyond it's just glutathione deficiency, but they started there. They started looking around. They're saying, this looks bigger. This looks different. Here's what they said. I want to say, remember, Sweden didn't do a lockdown. Sweden was a country that didn't do a lockdown. Say, we're not doing that. We don't believe it. We're not doing it. So they were thinking of how do they treat this as fast as possible. This study changed how COVID was being viewed even more, in addition to, hey, it's endogenous glutathione deficiency. It wasn't about only glutathione deficiency, NAC and homocysteine, but the entire methylation process. The methyl groups were being attacked. What made these guys see the bigger evolving COVID picture? Why'd they nail it? And they did nail it. So COVID-19, a methyl group assault, medical hypothesis, in part because they saw this study the year before. That one from Hyde Park, right, between New York and Albany, that 2 report, they're saying, hey, they treated. They didn't go, this was not a hypothetical. They said, hey, we treated 2 people and they all got better. And we did it with oral and IV glutathione precursors, N-acetylcysteine, and alpha-lipoic acid. They threw the whole boat at them. They said may represent a novel treatment approach for blocking the NF-kappa B cytokine storm inflammatory pathway. So they read that and said, that's right on the money. That was the clinical trial I told you about that these guys are now doing. Is COVID-19 an attack on methylation? What does this mean? What does this mean? So this is what they're saying. They're saying, I think it's a bigger picture. I think as the virus comes in, it hijacks the whole methylation system and takes all those methyl donors and methyl support things and uses it for the virus replication. So it says, we're going to borrow that whole apparatus because we need to make our own apparatus, which is make the virus grow as fast as possible. But here's their thinking. Its diverse symptoms of COVID were reminiscent to them of B12 deficiency. Nobody said that before. We heard about glutathione. They're saying, oh, it looks like B12 deficiency. Seriously, a condition in which methylation status is compromised. B12 deficiency is otherwise known as pernicious anemia. Pernicious anemia really hasn't happened in the United States anyway since before 1900. And I did a video on this coming up on Abraham Lincoln's wife had pernicious anemia and all the psychological aspects of that. But that's amazing. They tied in B12 deficiency with COVID. Nobody else did that before. So the socioeconomic implications of COVID-19 are devastating. Considerable morbidity is attributable to long COVID. It goes on and on and on. And increasingly recognized complication of infections. That is, people who made it out of the hospital, went back home, but they never really got better. So we postulate why COVID infection leads to increased methyl group requirements and other methylation disturbances. This might explain the varied symptoms of long COVID, as well as to conditions like, listen to this, myalgic encephalomyelitis, which is otherwise known as fibromyalgia, and chronic fatigue. So they're saying, long COVID looks a lot like chronic fatigue and fibromyalgia. So the hypothesis is it can be determined by simply assessing B12 status in people. Just like that last lab said, hey, just check the glutathione level. We could do that, right? Yes, we can. They're saying, hey, just check the B12 level. We can do that, right? Yeah, absolutely. And the folate status, absolutely, including serum homocysteine and methylmalonic acid. Those are things you do at the same time. It's a little redundancy, but it's a good thing. If this is proven, this is from their study, if this is proven true, then methyl group support should prove dramatically beneficial in such individuals. And so to be fair, if you're giving glutathione by itself is a methyl support, right? You're supporting the whole methylation system. So glutathione, NAC, alpha-lipoic acid, B12, folate, choline, betaine, and on, we'll get into it. Clinical experience of these syndromes, this is still their study, led them to consider B12 pernicious anemia was a big part of COVID. Hadn't been mentioned before. Whether a common denominator exists between B12 status and COVID and its aftermath of long COVID. They're saying they're focusing on B12. And they went so far as to make up a list of these are all the symptoms of B12 pernicious anemia. Pernicious anemia technically is an autoimmune disease in which it affects your stomach and you can't release a thing called intrinsic factor. And so if you can't do that, you can't bind the B12 from your food, and therefore you become B12 deficient. So it's not about diet, it's about autoimmune. You've stopped being able to take in the B12. Okay, so they listed all the symptoms of B12 deficiency, pernicious anemia, versus long COVID. And they found they all line up. They're worse in B12 deficiency for the most part, and all but muscle ache. B12 doesn't have muscle pain, but all the other ones were there. So that was impressive. They really got into it. So continued. This is their report continued. Their thinking continued. They're saying, in long COVID, there's a remarkable overlap with symptoms described by patients with pernicious anemia, especially those who suffered significant delay. In other words, they just didn't feel great. And by the time it got to be really open and identifiable B12 deficiency, that time difference was great. It wasn't immediate. It wasn't like getting a cold or a flu. Oh, I got it. Nope, not like that at all. So pernicious anemia causes your immune system to attack the cells in your stomach that produce the intrinsic factor, which means your body is unable to absorb B12. Pernicious anemia is an autoimmune disorder. So this brings up two questions, all right? These are pretty much my questions. Is there a higher incidence of COVID with pernicious anemia? And the answer is yes. According to this study out of Singapore, COVID-19's toll on the elderly is vitamin B12 deficiency an accomplice? And they, in the course of that paper, they said, yes, it is. Those who are greater B12 deficient had greater risk of a worse outcome. Second was, do people taking a proton pump inhibitor that induces a B12 deficiency? So a proton pump inhibitor is like, can't think of the common name, but basically people take it for heartburn, or they take it for heartburn and they take it for ulcers for a short period of time. But the problem is they start taking it for a year or 2 or 3 or 4, and it goes on and on. Moreover, chronic fatigue and myalgic encephalomyelitis is also a B12 responsive syndrome. And it is often initiated by infection, and it is thought to evolve into an autoimmunity at some point. So they have that chronic fatigue, it eventually becomes an autoimmune, so the cells can't release the intrinsic factor and they start becoming B12 deficiency. So now let's look into, is there a risk with proton pump inhibitors and COVID? Sorry to interrupt, but this is the end of part 1. I so hope you're as excited as I am about all this information that's come out of the last few years, showing what we can do for ourselves to fight off viral respiratory infections, otherwise known as the flu season, otherwise known as, see you on the other side. So if this is something that you're interested in, that is a topic that I obviously go deeper in terms of labs, in terms of how to do it, in terms of why you would want to do it, various topics, as you've seen that I've done in the past, then please let me know below in a comment. Till then.